Gene editing is a concept that 50, even 20 years ago would have been considered by many as a thing of science fiction. With recent developments in gene editing, particularly CRISPR Cas9, medical breakthroughs are definitely on the horizon. Today, we have a guest lecturer, Dr. Cal, aka Dr. Cal Ur Science Pal, a postdoctoral researcher in genetic medicine and a fellow science communicator to break down the social and scientific landscape in gene editing. Welcome to BS, a podcast where we take an in-depth look at different scientific and social phenomena and innovations, whilst tying them back to broader societal perspectives and why you should care. We're so excited to have Dr. Cal on, and we hope you enjoy the episode.
Hey guys, this is just a PSA about today's episode. We were suffering from some audio and visual issues, and so you'll see that people's audio quality will be going in and out. Some of the screens may be a little bit blurry, and some of the clips might be haphazardly cut together in order to try to preserve audio quality. You'll also see us looking down at our phones and at our laptop screens to communicate about those technical difficulties. So just in general, please bear with us, and we apologize for the decrease in quality. We still hope that this is a very informative and fun episode to listen to, and we loved having Dr. Cal on. So in general, apologies, but thanks, and we hope to see you guys for future episodes. All right, hello everyone. Today we have a very special episode. We're doing a guest lecture, and so we have Dr. Cal. She's going to be talking to us about recent innovations in gene editing. A very hot topic in the streets lately. There's so much to unpack there. So we're so excited that she took the time to be with us, and we're very excited to wade through the BS. So yeah, go ahead. So our first question is, take us through your academic journey and what you're currently up to now.
Yeah. Okay. So first of all, thank you for having me. This is my first podcast. I'm very excited. My academic journey, I actually hated science for like a really, really long time. And when I was younger, I just wanted to be a poet, and I was one of those like super crunchy like granola types that was like like the thing about the world that's beautiful is like the mystery of it, and like science is so sanitizing and sterilizing. It was terrible, and like blah blah blah. And then I took like one molecular genetics course in high school, and I was like, oh, actually this is kind of cool. And so I was literally like in the process of applying to university before I even considered science. And I did my undergrad. I went in as a double major in creative writing and molecular biology. And after I graduated, at a certain point, one of my mentors sat me down and was like, you kind of have to pick one. And it's easy to do writing as a hobby, but it's quite difficult to do DNA editing as a hobby. Not impossible, depending who you ask, but it's a lot harder. So I went with science. I joined the National Institutes of Health for 2 years. And after doing some research for them, I moved to London for my PhD. And after completing that, I am now a postdoctoral researcher at this cool research hospital here in London.
That is so wonderful. First of all, I did some shameless snooping on your account, and I saw your poetry content, and I was like, that is so fun because I also write poetry. I also grew up writing a lot, and
Really?
yes, and I got into college and I started doing spoken word actually, because
Cool.
it was a whole backstory, but basically people started inviting me to do spoken word and stuff. So I was like, oh my god, a fellow half STEM, half humanities baddie. Very,
Yeah.
very cool
Yeah.
and I definitely have heard the same thing about, you have to kind of pick one, but I try to make it a priority to still have both in my life. So,
Yeah,
but
of
I
course
ended
you
up
have
once again
to.
majoring in, you said what? Sorry.
I said you have to. You have to keep both.
Yeah.
Yeah, so definitely very interesting. Sorry to cut in.
But yeah, I definitely think that like having that double major is really beneficial when you're going into the STEM field. Like I had a TA and she was like very passionate about writing, and she was a neuroscience and English double major. And while she did like go and end up pursuing like her PhD in neuroscience, and she's in her last year right now, like when you ask her if she would make that decision like 10 times over.
Yeah, I think something, obviously there's a lot wrong with the education system in America,
Well,
including the higher
yes.
education. But living in England, most of my friends obviously went to university here, and like they just don't really let you do that. Like you take the courses that are towards your degree, and also you kind of have to specialize towards a degree when you're like 15. Like while you're still in high school, essentially, you have
France
to
is the same way.
commit to a degree. It's
Yeah.
so wild to me. I'm like, how is this the one thing that we got right?
I'm saying America will surprise you in the most just unexpected
Yeah.
ways.
Yeah, what's interesting is that I feel like a lot of people actually do not like how unspecified like the U.S. bachelor's degree is. I feel like at least especially when you're in STEM, you hear a lot of people complaining about ethics courses, about writing courses, about this, about that.
I mean, I feel like so much of the distrust that Americans in particular have in science is the fact that like a lot of us are really bad communicators like because we're not it's not prioritized for us, like writing and communication are not prioritized for STEM majors nearly enough. So I think there should be even more like diversification of the portfolio for STEM majors in particular.
No, I definitely feel you, and I'm happy to see that other people are prioritizing both. Because I once again definitely had people kind of tell me like, oh, you have to pick one. So I
Yeah.
think that everything you do is a choice, you know, and you should continue to make the choice that works best for you and your interests.
Yeah.
So gene editing, obviously why we have you
Yes.
on. Like I said, huge topic in the streets. I'm sure everybody has an opinion if they were to weigh in. And it kind of has been a huge topic for decades at this point, both within the scientific community and outside of it. So if you had to talk to somebody who had no idea what gene editing was or consisted of, how would you go about describing that or having that first conversation?
Yeah, so the analogy that I always use is I call it like the IKEA metaphor. And honestly, like I talk about this so much at this point. I've given like 3 talks on this. They should really be sponsoring me. But
Oh, okay, you know what? Okay.
if
No, you're
you
real.
if you imagine if you need a chair, you order one from IKEA, and they go into their little database of files that have the instructions, and then they print out a booklet and they send it to you, and then you build the chair. But if there is a typo in those instructions, your chair is not going to come out right, and if you try to use it anyway, you might get hurt. So in this sort of analogy, the chair is a protein, and proteins are just the sort of tools and equipment that your cells use to do their jobs. And the big master database of instructions at IKEA HQ, that's your DNA. And then each little individual file of individual instructions booklets to make specific bits of furniture, those are your genes. So historically, medicine has sought to treat genetic diseases by just treating the symptoms. And a lot of the time that's accomplished by introducing a chemical that sort of helps the chair function as a chair, but you're still building a broken chair. So what DNA editing will allow you to do is go into that master file down at IKEA HQ and fix the typo that's causing the chair to be broken. And then you don't have to take medication ever again, in theory. You've just fixed the problem at the source, and your cells know how to make proteins properly.
You know, I love this method of science communication because I don't think I would have ever thought about describing gene editing with an IKEA analogy, but that
Yeah.
actually is very, very applicable, you know, building blocks. So,
Yeah.
No, that was super smart. Like, especially for someone who
Thank you.
isn't gonna
Yeah.
be
Use it.
into.
Everybody, yeah.
the next time I talk to somebody about gene editing,
Like
so
it.
think of IKEA.
Yeah, exactly. Yeah, so in that analogy, obviously you can explain like the gene and the DNA, and then like I think the little physical instructional booklets I think function really well as analogy for mRNA, where it just sort of like gets printed off when you need it and then shipped over to the thing that's going to build the chair or the protein. Yeah, people tend to like the analogy because I think it's something that they are familiar with conceptually already. And you kind of just paste other bits of unfamiliar stuff on top of it. I guess I don't need to explain what an analogy is. I'm just rambling.
No, you're very good. I mean, that makes a lot of sense. Do you feel like people have been very receptive when you've used that analogy? Like they kind of come away being like, okay, I understand a little bit more of this topic.
Yeah, I think that's my favorite part of SciComms is, again, coming from a creative writing background, being like, what thing can I use, like what metaphor can I use to describe this thing that is factually accurate while still being like simple enough that everybody will be familiar with it. And that's kind of my favorite challenge of SciComms in general, is just the creativity aspect of it.
No,
Yeah,
that definitely makes a lot
that's
of
a
sense.
super like functional analogy. So, in terms of gene editing, can you take us through what the difference is between just gene editing as like an idea and specifically like CRISPR-Cas9?
Yeah, so CRISPR is a specific technology that can achieve, that can be used to achieve the goal of gene editing. There's a lot of different ways to edit DNA, and the definition itself can be like broadened or narrowed to include or exclude other technologies. But CRISPR in particular is sort of the in the past decade, it's been like the new kid on the block and the most exciting innovation that we've seen in a really long time. And do you want me to talk you through sort of like the technical aspects of how a CRISPR reaction actually works?
Oh yeah, for
That would
sure.
be great.
Okay, cool. To to understand CRISPR, I think it's good to understand where it came from. So essentially, there's a specific kind of virus that infects bacteria by injecting their own DNA. It gets integrated into the bacterial genome, and that DNA essentially tricks the bacterial cell into making new copies of the virus. But bacteria, understandably, don't like this. So if they sort of catch a virus doing this in the act, they will attack and sort of chew up the virus's genetic material. But they also do this kind of like really clever thing that's sort of like how our immune systems work, where they will keep a little piece of that virus's DNA and copy it into their own DNA. So it kind of functions like when you walk into like a liquor store and you like see those pictures on the wall of like, don't let this guy in here. It's kind of like that, where they've taken a little snapshot of this invasive material and been like, if you see this guy again, don't let them mess things up. And this little snapshot of genetic material in the case of CRISPR is called a guide RNA or gRNA. And the guide RNA gets carried around by a sort of security guard protein called Cas9. That's why it's called CRISPR Cas9 sometimes. So it keeps an eye out for any DNA that matches that little snapshot, and if it finds it, it will act to chew it up and get it out of the cell. And in the early 2010s, researchers realized that we could use that thing that bacteria had evolved to do naturally to essentially make our own little snapshots and hand that Cas9 protein a piece of RNA that we could design ourselves to match any piece of DNA we wanted in any organism's genome, in their DNA. And if you take a custom designed guide RNA, give it to Cas9, and put it into a human cell, it will find that bit of human DNA and chew it up. And then there's a couple of different ways that that DNA gets repaired, and that's the stage where you can actually essentially trick the cell into repairing it according to a template that you give it, and that's how you incorporate the edit that you want. So the three things that you need are the Cas9 protein, a little genetic picture of where you want it to cut, and then also, depending on your ultimate goal, a template for how to repair that DNA according to your own specifications.
Yeah, no, in terms of what you were saying about CRISPR Cas9 being the new kind of person on the block, she's definitely become the popular
Oh
girl
yeah.
at school for sure. And I remember the first time that I actually found out about CRISPR Cas9 was talking to Gold. And
Yeah.
so it was her telling me about one of her classes and about all of the drama that basically ensued when, what do you call it? I think it was the patents for
Yeah.
the eukaryotic version, right? Because I think Jennifer
Yeah.
Doudna currently, and to give context for the audience, Jennifer Doudna is one of the scientists that basically discovered the CRISPR mechanism. What do you call it? And she has the patent for the prokaryotic
Yeah.
genes, but not for the eukaryotic. And so, yeah, we went into depth about that. And I just became so fascinated by this technology after we
No,
had
like
this
my
conversation.
professor, he definitely, first of all, the first time I even heard about CRISPR, especially when you're in your like baby stem era, that like blew my mind completely, to
Oh,
be
me
honest.
too.
Like, like till this day, I really do think that it's like when obviously I always know like research is actually happening, clinical like studies are actually happening, but when like a big breakthrough comes through like this, it's always like such a shock to me, and especially the fact that it was like made by women. Like I already see the future of science already. But yeah, in Bio 142, which is like our second like very basic bio class at my university, my professor was definitely obsessed with the patent drama. Like
It's
obviously,
still
Jennifer,
happening.
yeah,
Really?
Yeah, like
Need to
10
know the
years
Jennifer
later, it's
updates.
still
Doudna,
happening. They're
and
literally
then
still
I think it's
like fighting
yeah.
about it.
Yeah, Jennifer Doudna and then Emmanuel Chantier, I think they have the original like prokaryotic patent. However, like I think Dr. Doudna, Dr. Church, and Dr. Zhang all submitted to the article cell, which is like, big boy research
Big
article
boy
within
scientific
the like 2 weeks of each other to like prove their work for the eukaryotic patent, and it literally was split between countries. I think Dr.
Hmm.
Dazzler had it in Europe, whereas like in the US, Dr. Zhang had it, and it was even more messier because Dr. Zhang used to work under Dr. Church, so it was just a
It's
lot
such heavy
regarding
drama.
that. Like,
Yeah, and I think recently, doctors Downa and Charpentier actually like withdrew the patent for Europe because it was
really,
like a low, I think a lower court made a decision that made it look like they weren't going to be able to progress with it. And they were like, rather than lose this outright, we're just going to take it back and not even bother continuing with this fight. And I assume regrouping and trying to figure out another strategy because I don't see them giving up on this. But yeah, it's just wild, like top to bottom, the way it shook out, where like one of them submitted it first and then the other one submitted it like afterwards, but with expedited processing. So their decision came first. It's just, it's wild.
No, it definitely became very messy very quickly, but it kind of also speaks to the ways that research kind of unfolds in a legal perspective and the way patents end up coming by. So, we want to get your take on this. Do you believe that there should be better protections to protect scientists' discoveries or a different method to determine rights? And kind of what do you see with the issues of the current system?
So I, to be totally honest, like most researchers, don't know a whole lot about like the patent law landscape or process. Like biotech patent law is very much like its own field, and there are like specialists whose job it is to help people like us figure out what the hell is going on because it's so incredibly complicated. Um,
so,
I think my thoughts on the CRISPR patenting thing are a little bit. I think it's a really complicated case that should be treated differently from a lot of other biotech patents. Because a lot of the time, a biotech patent, especially for medicine, is something like a specific molecule or applying something in a specific way to treat a specific disease. But CRISPR is not one independent thing. It's a technology that could potentially be applied to treat every monogenic disease. So owning it to me is kind of a morally sticky thing because whoever owns it gets to charge licensing fees to anyone who wants to try to use it to cure any one of 10,000 disorders. And obviously, people should get credit and compensation for their discoveries, but outright ownership and the ability to charge whatever you want for a technology is a little bit sticky when that technology, again, is not like a new kind of chemo where it's one specific molecule or a new medical device that you've invented to address a specific problem. This is something that has the potential to permanently cure 10,000 diseases. So ownership, I think, morally of that is a very interesting and sticky subject that I am maybe struggling to think of another biotech innovation that has that sort of scale of implications to it.
That's very fair. I definitely think it's so broadly generalizable, and that's actually kind of the same thing goes on in biomedical engineering, which you talked about with the patents of very specific molecules, or if they're developing drugs, it's just like they change like one thing and then they immediately resubmit for another patent. Even
Yeah.
at my engineering firm, it's like you just try to submit as many patents as possible for any kind of variation. I've seen like the silliest things be patented and then people get in trouble. Like, so I can definitely see how that can kind of come to an issue and something that has such, and also just the possibilities and capabilities of CRISPR Cas9. And
Yeah.
I definitely agree with it. It's not right to restrict the technology that has the ability to impact so many people's lives. But that leads me to my next question, actually. I've heard a lot of people talk about, and this is will always kind of be an issue with any scientific innovation, is that it starts out being highly inaccessible. It starts
Yeah.
out being incredibly expensive, highly inaccessible, and not necessarily able to kind of trickle down into the masses until maybe potentially years later when it gets a lot more affordable for people, and
Yeah.
is actually something. And so that has always become a talking point of any discussion. But at the same time, there could be moral issues with not developing a technology just because it may be inaccessible at the beginning. But through that development and through that testing method is how it ends up becoming safer for broader society. So I don't know if you have any specific thoughts on that, but
Yeah, I think I mean there's like so much wrong with especially the American medical system, living overseas as an American, like having to explain that like the concept of medical debt is so flabbergasting to the European mind. Like if you try to tell a Scandinavian person that insulin costs as much as rent, it's like you've told them that if you have diabetes, the government is going to come to your house and shoot you in the head. Like they literally cannot.
they
And
don't have
honestly,
neural
that
pathways
feels
to
bad.
understand that.
Yeah, like the
That's what it
number of
feels
times,
like.
like with my colleague, I would like explain the concept of like insurance and specifically not having insurance, where I'm like, if you're unemployed, like a lot of the time you just don't have insurance, and if you break your arm, you have to pay $60,000. And she's like, but what if it was an accident? And I'm like, you still have to do it. And she's like, but you didn't mean to. And I'm like, yeah, I know. Like they just cannot get their heads around it. So I think like obviously there's a lot that needs to change. And I think that in an ideal world, DNA editing in particular, will be treated as what it is, which is medicine. Like it should undergo the same kinds of rigorous safety testing and regulation as other medicines do, and it should be covered ideally by some form of insurance, and where that insurance comes from, we'll see. But another, I think, interesting fold of this is the use case for CRISPR has sort of naturally become ultra rare diseases. Because again, we don't have specific individual molecules or devices that can help with these individual diseases. But CRISPR is so universally applicable that if you have a patient, like one patient who has a disease that 100 people in the world are known to have, and there is no way that there's going to be an FDA approved pharmaceutical intervention for this. What we have seen most recently with this case, baby KJ, at I believe it was the Massachusetts Children's Hospital, where he was born with a disease that was most likely going to kill him in early infancy. And so his parents did something incredibly brave and allowed doctors to use CRISPR to try and fix the issue. And it seems so far like it's working. And so these sort of N of one cases of like extremely specific, individualized precision medicine where you have this mutation that maybe nobody else in the world has, and we're going to use CRISPR and its versatility to fix that so that you don't have to wait around for a pharmaceutical drug. I think that's going to be an increasingly popular use case for this technology, which then circles back around to the question of, well, how do you figure out how much that should cost? Because it's a therapy that doesn't even exist, that you are custom designing, that will only, in theory, ever be applied to a handful of people. And how do you work out what the money's going to be there? And I can only hope that the answer will not be, it's prohibitively expensive, we're not going to do it.
No, I completely understand that. My family, like personally, we have a lot of members with chronic illnesses, so trying to explain, like, hey, like, you may move states in order to have like a better chance at getting like a specific therapy because we cannot afford it in our states does sound mind-boggling. So
Yeah.
I definitely think there is just a larger systemic issue clearly with the United States and the way we do quite literally everything in regards to like medical pricing.
Just everything.
Just everything. You can say it. Just about everything. Except letting people double major. That one we're keeping.
Let's keep that. You know,
we're keeping that. Everything else goes in the bin.
For everything else, let's keep that.
Yeah. Yep.
No, but I definitely, actually, baby KJ, what an amazing discovery. But because that was what the first personalized, what do you call it, in vivo treatment of CRISPR, correct?
Yes. Yeah.
Gotcha.
It was the first time that they just were like, well, we've designed this molecule, let's try it.
Gotcha.
Without a clinical trial first, which again was so brave of his parents. But when you're in that situation where it is most likely going to be lethal and the disease is so rare that you can't really count on a clinical trial ever happening for a pharmaceutical drug, that's where I think CRISPR is going to come in huge.
That definitely makes a lot of sense. I know it's already been used to cure, I think, sickle cell in Victoria Gray. I think she was the first ever person to have CRISPR used for sickle cell. And so we're seeing all these monumentous cases. I think she was in the UK. So yeah, seeing monumentous cases across the world. Momentous. I cannot pronounce things today. I think it's momentous. I don't know why I said momentous. Momentous cases across the world. It's very heartwarming to see. So yeah, I think at the end of the day, prioritizing accessibility and what do you call it? When you also think to a treatment that's going to be incredibly effective, at least from what we've seen so far, I definitely think there also should be priority lent to the fact that this has something that has the capacity to be so life-changing, which at the end of the day should be the end goal of our medical system, is to kind of eradicate that harm to human lives. So.
Absolutely. So again, the idea of somebody, an individual or a company, having a monopoly on the use of CRISPR in eukaryotes is like, are you sure?
Yeah, it's very scary to think about.
Yeah. So we'll see. We'll see how it comes out.
No, we'll see how it shakes out. But obviously, no discussion of gene editing can occur without talking about some of the ethics and many moral conundrums that come up when it comes to gene editing. Obviously, we've already kind of touched on accessibility and then patent issues. But aside from that, what are other ethical concerns that you think present themselves when talking about gene editing?
So I think the biggest one for me is the money issue.
Gotcha.
Like hundreds of thousands of dollars per treatment, we're talking. And obviously that's gonna make this life-saving medicine inaccessible to a lot of people, as we sort of discussed. But again, as we also discussed, that is an issue that goes sort of beyond genetic medicine into medicine in general. In terms of a more DNA editing specific moral issue, people get really nervous about what's called germline editing in embryonic DNA editing. So for the people at home, in case you don't know, well, you probably do, but we all start as a single cell, right? And if you tweak the DNA of that single cell, then every cell that makes you will carry that tweak, including the cells that are responsible for making your sperm and egg cells. So that edit will be not just in every cell of your body, but every cell of every generation that carries your DNA from then on. And so the alteration of an entire bloodline that you cannot take back is something that people are understandably very nervous about, because doing DNA editing in an adult person only in the tissues that where it's required. So for example, with the sickle cell anemia, it's only in the bone marrow. So in theory, Victoria Gray's children would not carry that edit. But people get nervous about that. And I am personally optimistic that someday we will have enough of an understanding of the human genome and of DNA editing technology that we can confidently say this is safe and we don't have to worry about ruining an entire bloodline. But I think right now, I firmly believe that we are not there yet. And then another thing that people tend to get wigged out about is cosmetic DNA editing. So DNA editing for purely cosmetic purposes. And this is where I think I have like a little bit of a radical opinion on this.
I want to hear it.
I think that falls under the umbrella of bodily autonomy. I think that if a person wants to get a safe and effective, again, we don't know yet if it's fully safe and effective in terms of like for non-life-saving medical purposes, but if one day we know that using CRISPR to change some aspect of yourself cosmetically is safe, I don't see that as too fundamentally different from getting some form of cosmetic surgery. And that's where like all the other questions come in of like, okay, well, what is the beauty standard you're matching? Who made that beauty standard? What kinds of pressures have you faced? Is it truly autonomy, or are you bending to some external pressures that are built, that are coming out of systems that were built by people who, don't look like you and never did, and you shouldn't be pressured to look like them, etc. But again, that applies to all cosmetic procedures, not just DNA editing. So I think a lot of the ethical dilemmas surrounding DNA editing are things where, if you sort of zoom out, they exist in other kinds of medicine as well. There's just these specific cases, such as the issue of germline editing, where it really is a DNA editing unique issue.
So yeah, on the topic of ethics regarding CRISPR Cas9, I feel like we have to bring up He Jiankui. He was a Chinese researcher who did perform, well, he didn't perform it, but basically like he, according to the legal documents, manipulated physicians into using CRISPR on 3 infants embryos before their birth. And on one side of things, a lot of people are like, that was just completely unethical, and that's not something that has been cleared so far, and it was dangerous to make such a decision like that. But I feel like he's made arguments, and I've heard people agree with him in the scientific community with the idea that certain ethical concerns and certain rules we have may be holding scientific innovation back.
Yeah, so I think I see this sometimes in my comments where people are like, bioethics is holding back scientific research. Ethics is not holding back scientific research. If science cannot be done ethically, it should not be done. Like, period. And I think in the case of what He Jiankui did, I have a lot to say about this man. I
think many people agree with you on that.
I want to put him in a jar and shake him a little bit. Like, it's like, why did you do that, bestie? Because there was no There was no
Why did
reason.
you violate ethical codes, bestie? Like,
Yeah, and also why did, like, if you look at what he actually did scientifically, there was no reason to do it in the first place. Like, he basically was trying to delete the cellular receptor that allows HIV to enter cells. And he was proposing this as a way to eliminate the risk of like intergenerational passing on of HIV. But these embryos that he implanted, their mother did not have HIV. Their father did, but their mother did not. You do not get HIV from your father via like reproduction. It comes from the mother because you're sharing blood. She didn't have HIV. There was literally no reason to do what he did. He also did a very poor job of it. Like one of the twins, he only edited one allele, so she was heterozygous, which means that the receptor was still getting expressed, so that didn't work. And then in the other twin, he edited her or after the first cell division had occurred, and only edited I think one of the cells or a smaller subset of cells. So she is now a genetic mosaic and has some cells that are expressing it and some cells that aren't. So the virus can just show up and be like, okay, work. I guess I'll just ignore those cells and go for those ones. Like there was no reason to do it, and it didn't work. So even if he hadn't been a huge monster ethically about the whole thing, he just is a bad scientist. Like,
don't feel bad for saying
Don't feel bad because
I go around pointing at people like bad scientists, bad scientists.
Yeah. You did not do a good job.
No, and honestly, the bar about ethical or what do you call it? Research shouldn't be done if it's not ethical. I like that. I like that. I'll be stealing that.
And like
that should be common knowledge. Like.
Yes. I think the question there is like, are the bioethical standards that we currently have like still applicable in every case that they are applied to? That's a separate question. I don't know how to answer it. Again, I didn't take a bioethics class in college. But I think when people talk about bioethics, a lot of the time what they are frightened of, and I'm just saying this as what I've seen like in my comment section, what people are frightened of are these wild, extreme, fringe, potentially unsafe or like objectively unsafe application of these technologies that are purely hypothetical. No one's doing that. One guy did it, and then everybody was like, hey, don't do that, and then he went to prison. So to me, like, the true ethical threat to humanity when it comes to science is inequity within the science that's already going on. Like, we need to start there, because we have the tools and technologies to vastly improve the quality of life for hundreds of millions of people, and we are choosing not to do it because those groups are women or people of color or disabled, or like whatever reasons we have come up with to justify the idea that some people don't deserve research to be done on them. In my mind, the primary ethical adjustment that needs to be made isn't like preventing people from putting up legislation that prevents people from doing stuff that nobody's doing anyway. It's ensuring that we use the tools that are already available to help people regardless of how historically marginalized or underrepresented they have been.
No, that definitely makes sense. And I think when scientists act in a way that's so inappropriate, it kind of casts a stain, especially considering like post-COVID or semi-post-COVID, like the current reputation that scientists, researchers, doctors have amongst the general public. We're already, I feel like, walking a thin tightrope in terms of how we kind of present ourselves. And so situations like this is what contributes to eroding the public's trust. But it was heartening to see the amount of backlash that he got from the scientific community, because it was waves of people being like, this is not acceptable, you should not be able to do this. And so it was at least something that makes me feel a bit more calm and kind of comfortable, is that there were so many scientists that were willing to step up and say, hey, this is a revolutionary technology, we want to be able to help people with this, but this is not the method to do so.
Right. Yeah. And honestly, to add on to that, like, I feel like the He Jiankui situation is also a, like, signal for science in terms of like you already said, like we just have forced communication because I do think a lot of people who aren't in the community do see him to something as a hero and that he saved these like babies from being able to get HIV. And I've seen like videos of him on social media that are getting way too many likes, to be honest, like saying things that are just one good but two just objectively untrue about the situation. And honestly, science communication on his part, because the paper that he did write that everybody refused to publish about the twins and again the secret missing baby that we still don't know about was very like unfinished, so many questions left unanswered. It was just poor work in terms of communicating the legal thing that he already did as well. So like there was poor communication to the scientific community, there was poor communication to like just the general population of people and like what that means for them. And I think again like there's a lesson to be learned from that as well.
And I think the whole issue of like one of the major ethical violations of this was a lack of informed consent, which informed consent is a
It's like the
form.
first thing they teach you. Like,
Yeah.
it's like I feel like that's Science 101.
Like the fact that this was able to even occur is also
Wild.
mind blowing to me. Like
Absolutely wild. Yeah. But yeah, I even just like the act of being able to get truly informed consent from a patient requires some psychoms. Like you have to, in order to inform somebody, you have to communicate the science that's happening in a way that they actually fully understand. And he quite simply just did not do that. And that to me is one of the biggest ethical violations. Even more so than using an experimental technology. Doing it in such a way that the patients didn't actually grasp what was happening is such a nightmarish thing. And I guess on that front, I need to backtrack a little bit on what I said, where I guess the idea that like these fringe extreme things aren't happening is not necessarily true, because they have happened in the past, and the people they've happened to have historically been these marginalized and underrepresented communities. So ensuring, I guess it's not something that you can point to as a distraction tactic, which I feel like it came off as I was doing, of like, let's not worry about these extreme fringe applications of these technologies and just worry about making science more equitable, because the inappropriate application of these extreme fringe technologies throughout history has been part of what has made science and medicine not equitable. So they are very much an overlapping issue. And I feel like I simplified it too far by treating them as two separate things, I think.
No, I definitely understand. And
Yeah.
I'm glad that you kind of touched on the understanding of how intersectionality kind of plays into this conversation, because at the end of the day, science plays out in society for a human being. I think people try to apply a lot of binary thinking to it. In my perspective, at least, or at least the way I approach engineering, and this can go for any major, but is that we engineer things for people. Whether it's civil engineering, whether it's biomedical engineering, whether it's chemical engineering, whether it's software engineering, like every engineering product is used by people. That's the entire point. And so when you try to disconnect these two processes, it leads to terrible outcomes like these, because people have never really thought to think beyond kind of their desires of the situation. And so
Yeah, absolutely. And I think also it's kind of like circular, I guess, where like they are designed for people and they are also designed because of people, and like who gets a say in that demand is something that historically has not been fair, and in many ways still isn't. In terms of like, and we're seeing that play out in real time in America right now, where like I think it's never been more apparent to the public that science is inherently political, because where the money goes is often not being decided by the scientists. Like scientific research doesn't happen just because a scientist wanted to do it. It's that plus somebody had to give them the money for it. And deciding what is worthwhile to research is inherently incredibly political.
No, grant applications are such a huge part of a scientist's time, and
Like you can tell when the PI is going through it. Like
hey, there in the lab when I would walk in when a grant was due, nothing was funny.
No, absolutely not. Yeah.
crack no jokes when you get in coffee in the break room.
Mm-mm. Yeah, everybody knows what the deadline is.
Exactly,
Yeah.
exactly. And yeah, I'm glad that you brought that point up because, like you said, it's not just this like I shake the magic 8 ball and boom, this is the experiment I decide on. And
Yeah.
obviously, anything can be seen as unnecessary or frivolous if you word it in certain terms. And I feel like we've definitely kind of seen that as well, where it's like trying to paint certain research as undeserving or not
Yeah.
beneficial to society, but
The
it's because
transgender
of your
mice.
taking
I
away
was
all
just
the
gonna say. I was just gonna
you didn't
say.
hear about the transgender mice? Like, oh my
No.
god.
This was like making the neuro community absolutely like just like eye twitching. Like, are we serious right now?
The neuro community, child, I was literally just like, I have to log off all my devices and
Right?
go breathe fresh air and touch grass because I know
Yeah.
we are just I must be in a different dimension. This can't be real life.
Yeah.
Because why
This
cure
can't be real
Alzheimer's for
quotient.
the queer people? Like,
Yeah.
But yeah.
yeah. So honestly, with our current not only scientific landscape, but like as you touched on, also our just like social and political landscape and the way we receive science, what do you see in the future of CRISPR? What would a person in like the general population expect from that? How would you see it popping up in medicine? More like in the near future.
Yeah, so again, I think the biggest recent development in terms of like having broader implications for the future of the application of CRISPR is that sort of N of one study with baby KJ, where um, again, because CRISPR is not an individual molecule that can be applied to a specific disease, it's kind of challenging the paradigm of how drugs and medicines get approved, where across different applications of CRISPR for different diseases, the only thing about it that changes is the sequence of that guide RNA, or the sort of like who's in the picture. Um, and so questions have come up about, do you need to do a full-scale multi-phase clinical trial for every single guide RNA that could potentially be used to treat every single monogenic disease, given that, so with sickle cell, it was a great candidate for the sort of first go at using CRISPR to treat human disease because every patient with sickle cell anemia has the same mutation or the same variant in their DNA. So you could just come up with one guide that would fix absolutely everybody. But I work on a disease where there have been over 800 different pathogenic variants characterized within this one gene. So if you have to do 800 clinical trials to help all these different patients, it's just not really going to be feasible. So there's this push now for a sort of one gene, one approval type of system, where instead of testing each individual guide, you say, is it safe to target this gene in a gene editing context? And then using tools like machine learning and lab on a chip technology, and very, very, very thorough, in-depth in vitro testing, can you assess the efficacy and safety of one individual guide RNA without having to do the multi-phase clinical trial and the non-human animal models, just to sort of speed up the process of getting these medications approved for the patients who need them. So that, I think, is going to be the sort of regulatory aspect surrounding CRISPR is going to be a big hot button topic in terms of how it gets approved, how it gets applied, again, in terms of access and money, and then also in what context it's applied, again, returning to the idea of germline editing. I think we are a very long way off from being comfortable doing germline editing. I think that we need to seriously overhaul some things, especially in the States, to address the money issue. But I think that in terms of like the making it easier to turn this into medicine step, there is already a big push happening for that. And I'm optimistic that in the next like 10, 20 years, we might see a world where DNA editing based therapies sort of have their own separate pathway to getting regulatory approval versus more conventional pharmaceutical interventions.
That's good. On the to pick off of something that you said about specifically targeting one specific gene, I've heard that it starts to become a lot more complicated for diseases that are far more complicated, far more complex in their pathology. So there are like maybe like dozens or even hundreds of genes that contribute to a disease state. So how have scientists so far been trying to tackle those diseases?
So that's a great question. I don't actually know of any case. So, okay. I think one of the spaces within DNA editing that I am hugely ignorant of is its applications in cancer. And I think, from what I understand, rather than trying to correct underlying pathogenic variants that might make a patient at risk of developing cancer, because there's so many of them and they're so complicated, and there are all of these incredibly diverse, complex risk factors that may or may not contribute to the cancer, and then once you have the cancer, it's kind of too late to address that issue of you having an increased risk of getting it. So a lot of the CRISPR applications for cancer are sort of coming at it from the other side, where rather than fixing the patient's own healthy DNA, you are using something unique within the genetics of tumor cells to target them specifically, or engineering immune cells to be better at finding and killing tumor cells. But again, the specific examples of like clinical trials about that, I'm actually not super on top of. But like CAR T therapies in particular, I know are like a big, exciting thing right now. Like I think we are seeing a big boom in CAR T therapies specifically, which is where you use DNA editing to make T cells better at finding and killing those tumor cells.
No, but honestly, it's okay because this is such like a broad field. Honestly, like I think it just speaks to its many universal applications, and also like why it's so important to have kind of researchers who are very specialized in what they're dealing with, because they understand all that goes into their kind of specific niche. So I definitely understand that. And also I feel like with CRISPR-Cas9, things are moving quickly.
Yeah.
And it can be hard sometimes to see all of the changes that come your way. So
Yeah. I think there's also been a lot of, not just within the applications, but within the technology itself. In the last decade, there have been so many new iterations of this technology in terms of it literally like at a molecular level functioning differently. There's prime editing, there's adenine base editing, there's cytosine base editing, there's passage, which I don't even remember the full acronym for. It's like programmable addition of site-specific something.
paste, is that
So
what it is?
paste, yeah, well, okay, so paste came out, and then like less than a year later, passage came out, which is basically paste, but like over 10 times more efficient. So like even, and I had like just written a grant about paste, and then like immediately irrelevant. And I was like, work, love that. Like, that's cool. Thank you so much, David Liu. If I listen,
Oh yeah, I wanted to bring him up because I
yeah,
saw that you said he's your science crush, your science
he is
guru.
both my crush and my nemesis. Like the
Oh,
most complex relationship I have with
Okay,
this
enemies
man.
to lovers.
I'm, I mean, maybe enemies to employer employee if he wants to hire me, but
okay.
like it's like every time the DNA editing field sort of settles into a new technology, he'll be like, everybody drop everything, I've invented something that's 10 times better. And it's like, can you just, like, we literally just got this up and running. Like, take a break, learn an instrument, like, how to Europe, like,
What happened to sabbaticals? Like,
literally, like, you
I
need to
can't
calm
pipetting.
down and let the rest of us catch up, because if you announce another PE system, I'm going to lose it. Like,
I
let us
definitely.
breathe.
But yeah, I know you talked about directed evolution and what he's got going on your channel. So another sector that's very, very interesting and will be cool to
Hmm.
see how it pans out.
Yeah, I think CRISPR is such an incredible technology that could genuinely revolutionize medicine from the bottom up. But we also, in order to allow that to happen, a lot of other stuff also has to be completely revolutionized and rebuilt. The access to it financially and practically, the way that it gets tested and approved. And also, yeah, it does open up some questions about bioethics that I think are going to require a little bit of a shift in how people historically have thought about that. And I'm really excited to see how that all unfolds in the coming decades. But for right now, I think we should just focus on, especially in America, keeping the science that we already have alive, and trying to make sure that it is being executed in a way that is actually going to help people who need it, regardless of what they look like, where they come from, or what underlying conditions they have.
No, that definitely makes a lot of sense. And honestly, that's a recurring theme for our podcast. It's kind of like,
Yeah.
whoa, look at this really cool new technology. Now let's look at the society that we currently live in.
Yeah. 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 Yeah, it does sometimes feel, I mean, even just me, like at work day to day, sometimes if I have an experiment go really well, there is always that voice in the back of your head of like, is this actually going to help people? Like, even if I nail this, knock it out of the park, cure this disease tomorrow, is there going to be a mechanism in the broader world that actually allows this to get to the patients who need it? And that is a really tough question to not have the answer to.
Yeah, like accessibility is like paramount to science, and like you said, current state of our union isn't necessarily prioritizing that, but we have to keep fighting, you know.
Yeah.
And I
And we
do,
appreciate that.
yeah.
Yeah,
Yeah.
we appreciate the scientists that are still clocking into their day job, even though
People,
we're at a point.
yeah. Well, a lot of people in my comments are like, are you okay? Is your research okay? I'm like, babe, I'm in England. Like I'm feeling very lucky right now that I am not still
Overseas.
working at the NIH and my job is safe.
I gotta keep telling myself, like, yeah, fight the good fight, and it's gonna work out. Because if I don't, like, I don't know what's next at this point in the
Yeah.
U.S. Like,
Yeah. And yeah, I'm very much like radical optimism at work so that I can cry about other things, like my cells getting contaminated or whatever. And then when I'm at home, that's my crying time about America. So
That's
you
very
gotta compartmentalize the cries.
pick and choose your battles for sure.
Yeah.
But yeah, thank you so much for coming on.
Mhm.
I think we had a really good discussion, and I'm glad that we were able to touch obviously on the science and the mechanisms. Shout out to the IKEA analogy. But then we also were able to kind of get into the ethical concerns of CRISPR and what it's even going to look like for everyday people like you and me. Because at the end of the day, when it comes to this revolutionary science, that's what a lot of people care about. So for one of everybody's favorite segments now is Bits of BS. So, for those of you that are watching for the first time, that is when we talk about funny, annoying, or just trying times that occurred while we were trying to get our degrees, specifically bachelor's. However, Cal, you are free to choose anything from your bachelor's to your fellowship to your PhD. It's up to you. And we'll let you start because you're our special guest.
Okay, so I was having a good long think about this, and I was like, I feel like nothing particularly funny happened during my bachelor's, but I do have a story of something that happened to somebody else. Um, so when I was an undergrad, I got a scholarship that would essentially it helped cover your tuition, and then it also gave you like a 9-week paid summer internship in a government lab, which was very cool. And like, I think a couple of kids from each state got it. And so our sort of cohort that summer, we all met up at the headquarters of this government agency, and they talked us through all the different projects that were available and stuff like that. And then we went off and we did our internships. And at the end, we came back and we presented at this agency the research that we had done over the summer. And there was this one young woman whose summer had been spent somewhere in the Pacific Northwest researching whales, and researching specifically whale song and how we could sort of use patterns and locations of whale song to figure out stuff about their ecology and their behavior and how to best protect them and stuff like that. So a lot of her summer had been spent like listening to and looking at waveforms of whale song. And so she gets up and she's presenting, and the first waveform comes up and she presses play and nothing happens. And we all realize that the sound, something has gone wrong IT wise, and there's no sound for her presentation. And I will never forget watching this brave young woman realize that she was just going to have to make the noises herself. See,
I knew it was going there.
She went through, like God's strongest soldier. She went through this whole presentation and just made the noises. Like, and watching her go just like speed run the stages of grief from like, this can't be happening to, okay, I guess this is happening, like in the span of like a second, and just open her mouth and deliver what has to be like the most well-informed and scientifically accurate impression of a whale a human being has ever pulled out. And we were flabbergasted. It was like 200 students and like a bunch of government officials just watching this unfold, and she just tore the roof off the place. She did an amazing job, and the resilience, like the strength of the human spirit was really on display that day. And she got like the biggest applause of the day, of course.
And she deserved it.
I was about to say, she worked for it. Okay, you can understand. She toiled for that. Would you listen to her whale sounds to go to sleep? You know, relaxing?
Oh my God, I would love to find her and see what she's up to today. I hope she is still doing that same research and befriending whales, and I hope they talk back to her. I hope she has gotten so good at it that
hope that queen is thriving.
Honestly, like that's a passionate scientist right there.
Okay? Oh yeah,
like you guys were going to be informed no matter what, and I like applaud her for that. Honestly,
yeah, exactly. She's an icon,
a legend.
Yeah.
Now my bit of BS. I don't know if I thought it was funny in the moment, but like if you were pre-med in undergrad and you did go through that psychological warfare, like you do understand like there was always like this underlying feeling that even things that didn't need to be like hard or targeted were like specifically like sought out for you. And for us, it was like always like the timing in which exams would be, specifically chem exams. Like genuinely before any break, before any semester end, like I swear, like the chem exam was always the day right before. You never got an extra day. Like you never got to like go home a weekend before. And like also like the superstition was like it was gonna rain that day. And like again, like not to sound very tinfoil hat, but like clockwork. Like you were walking back in that rain and packing that bag last minute every single time for a test that definitely whooped your ass as well. But like that was a whole other conversation. But like, yeah, everybody knew you were gonna wake up and that sky was gonna be gray the day of the exam.
Honestly, the collective pool of bad energy is probably why.
Really? Yeah.
Y'all are taking a chem exam the day before it's time to leave. That's why it's raining.
Yeah, like, yeah. Or just like the collective.
I believed in the folklore. I swear, like 85% of my chem exams, there was rain on that day. Like, I don't know what it was.
It was all of the tears everyone was crying the night before, like entering the atmosphere and ruining the weather patterns. Like, there was an abundance of humidity.
That for the whole like area.
Yeah, y'all were crying and sweating.
You see, you just cry before the exam. You know, condensation occurs, everything happens, and then boom, you walk out, and it's just. But honestly, isn't that the real reduce, reuse, recycle? Like, look at how
yeah.
That is.
Right, that's cloud seeding right there.
Okay, my bit of BS is it's really just comical. I was gonna say it wasn't funny in the moment, but it was funny in the moment. It was very funny in the moment. It's more of like a let me take a step back and look at the institution that I attended, just like the foolery that goes on around here. Gold already knows this story, but my bit of BS is that for one of my classes, my teacher ended up getting arrested. He got arrested for a DUI and a hit and run. Obviously,
What's this story?
you don't understand. When I
Like,
was when I tell you, and mind you, this was a professor that I had previously for a separate class. He was cool and all, not that good of a teacher, but he was cool and he wrote a rec letter for me. So like I was really cool with him and everything. And then what do you call it? Fast forward a year or two later, apparently he like got fired by the department, but then got rehired to teach this class. And so there was already a lot of drama between him and the faculty and our university department, basically, because I didn't know all the specifics, but the TAs for the classes and just people in the backsides kind of knew something was going on in terms of like his contract and his rehiring. And so he did not show up to those first couple of classes, and we were confused. And then there was even a message sent out saying that there was an emergency and he wasn't going to be able to come in. And we were all just
emergency.
the emergency. So yeah, it turns out that he got a DUI and a hit and run. I was able to access his mugshot, so I do have that in my camera roll. The mugshot of my literal professor. And he's smiling. Like he's smiling at his
Wow. So he was
me think. It really made because I was like, that class too was one of my hardest classes ever. It was biomechanics. So already it was a class that was notoriously hard. People didn't want to take it. The other professors also weren't that great for the class for separate reasons too. And I remember thinking like, this can't be real life. This cannot be real life. So like I laughed a lot, but when you really look at it, it's not funny. But I was like, wow. Man.
the fact that he was smiling in his mugshot tells you that man was drunk. Like to not even have the presence of mind to be like, I should be upset right now. He did not know where he was.
No, and it wasn't even like a big smile. It was almost like a smirk. Like I felt personally offended when I saw the image because I'm like, no way you smirking in your mugshot. Like,
No, that's hog
like a man
wild.
who knew he was up to some trouble. Who knew he was up to
Yeah.
it anyways.
It's very just like, well, damn.
But okay, thank you so much. This was such a wonderful episode. I was so glad we were able to talk to you.
Yeah.
And yeah, so with that, we'll see you guys in the next episode. Bye.
Bye. Thanks for having me.